Non-invasive assessment of tissue sodium content in patients with primary adrenal insufficiency by Chifu et al. PAI patients receive corticosteroids as replacement therapy. These help modulate sodium homeostasis, which includes serum sodium, which is affected by osmotic changes, and tissue sodium, which is not. Therefore, the efficacy of replacement therapy in these patients can be determined by measuring tissue sodium via sodium MRI. This is important as raised tissue sodium has been associated with cardiovascular complications. Hence, the aim of this study was to investigate whether PAI patients under replacement therapy experience changes in tissue sodium. To do so, 8 patients with newly diagnosed PAI were investigated under longitudinal analysis, and 22 patients with chronic PAI were investigated through a case control study. Sodium MRI was conducted in these patients, yielding RSSI values, and the results were compared to healthy controls. In patients with newly diagnosed PAI, serum sodium was lower compared to controls and follow-up. Muscle and skin RSSI were also lower compared to healthy controls. In chronic PAI patients, muscle RSSI was higher compared to healthy controls. Skin RSSI correlated with plasma renin concentration. So what does this mean for patient care? Well, tissue sodium is low in newly diagnosed patients and significantly increases under replacement therapy up to the levels of healthy controls. But patients with chronic PAI display significantly higher muscle sodium levels compared to healthy controls, indicating a tissue sodium overload associated with replacement therapy. To read more, please scan the QR code or use the link provided on the slide.